You know, I used to be the kind of person who reached for coffee every time I felt anxious or tense. Maybe you've been there too. That tight feeling in your chest, your heart pounding like it's trying to run a marathon, and your mind racing a mile a minute. It's uncomfortable, to say the least. And honestly, caffeine often made it worse. I would end up feeling even more jittery and on edge. So when I first heard about Kava, this natural root drink from the Pacific Islands that's supposed to help calm your nerves, I was curious, but also kind of worried, because I had something called tachycardia. Basically, my heart was already beating fast, and I didn't want to do anything that might make that worse. If you've ever had tension or a racing heart like that, you might be wondering the same thing I did. Can I safely drink kava? Or will it make my heart race even more? In this video, I'm going to break down exactly what kava is, what tension and tachycardia mean in simple terms, and whether kava might be a safe choice for people dealing with these issues. I'll also share some tips on how to use it carefully if you decide to try it. Let's get into it. So, what exactly is kava? Well, kava is a root plant that grows mainly on islands in the South Pacific, like Fiji, Vanuatu, and Tonga. For hundreds of years, people there have been making a traditional drink from this root to help them relax, reduce stress, and get a calm, peaceful feeling without feeling sleepy or out of it. The key to kava's effects are natural compounds called kavalactones. You can think of kavalactones like tiny messengers that talk to your brain. They work by gently boosting the activity of something called GABA, which is short for gamma-aminobutyric acid. GABA is a chemical in your brain that acts like a brake pedal for your nervous system, helping to slow things down when they're speeding up. When GABA is working well, you feel calmer and less anxious. That's why doctors sometimes prescribe medications that increase GABA activity to help with anxiety. Kava does something similar, but in a more natural and milder way. People usually take kava as a tea made by soaking the root in water, but you can also find it in capsules, tinctures, or extracts. The traditional drink tastes earthy and a bit bitter, with a numbing sensation on the tongue, kind of like strong black tea but with a little tingle. Because kava helps calm the mind and relax muscles, it's become popular in many countries as a natural alternative to prescription anxiety meds or alcohol, especially for people who want to unwind without losing mental clarity. But here's the thing. Even though kava sounds great for relaxation, if you have certain health issues like tension or a fast heartbeat, known as tachycardia, you might be wondering if it's safe for you. That's exactly what we're going to explore next. All right, before we talk more about kava and whether it's safe, let's make sure we're clear on what tension and tachycardia actually mean in simple terms. Tension usually means feeling tightness or stiffness in your body. It can be muscle tension, like when your shoulders and neck feel sore and tense after a long day, but it can also mean mental tension, where your mind feels stressed, worried, or just overwhelmed. When you're tense, your body is kind of stuck in fight or flight mode, which is your natural stress response. Now, tachycardia is a medical word that means your heart is beating faster than normal. Normally, an adult's resting heart rate, that's how many times your heart beats per minute when you're relaxed, is between about 60 and 100 beats per minute. If your heart rate jumps above 100 beats per minute when you're resting, that's tachycardia. It can happen because of things like stress, anxiety, too much caffeine, dehydration, or sometimes it's due to an underlying heart problem. When your heart races, you might feel dizzy, short of breath, or just uneasy. Now, here's why this matters. If you have tension or tachycardia, your body is already under some stress. So naturally, you might be worried that drinking something like kava, even though it's supposed to relax you, could actually make your heart race even more or mess with your blood pressure. And that's a totally valid concern. So in the next part, I'll break down what the science says about Kava's effects on your heart and tension, and what you need to watch out for. So here's the big question. Is Kava safe if you have tension or tachycardia? Let's look at what we know. First off, Kava is known for its calming effects without being a stimulant. Unlike coffee or energy drinks, which speed up your heart and can make anxiety worse, Kava works in a different way. It doesn't raise your heart rate. In fact, some studies suggest that Kava might actually help lower blood pressure and heart rate a bit, which could be good news if you're dealing with tension. Because Kava helps the brain relax through those GABA pathways we talked about, it can reduce feelings of anxiety and stress. And for some people, that means their heart doesn't feel like it's racing as much. So if your tachycardia is triggered by anxiety or stress, Kava might help calm your nervous system and slow your heart down. But there are a few important things to keep in mind. Some people report feeling lightheaded or a little dizzy after taking Kava, especially if they take too much. If your heart is already beating fast, feeling dizzy can make you more uncomfortable or anxious, so it's crucial to start with a low dose and see how your body reacts. Also, there have been reports linking Kava to liver problems, although these cases are rare and often involve high doses, long-term use, or mixing Kava with alcohol or other medications. Because the liver processes most substances you put into your body, including Kava, if you have liver disease or take medicines that affect your liver, you should be extra careful. Another thing, if you're taking medications that affect your heart or blood pressure, or if you have serious heart conditions, it's essential to talk to your doctor before trying Kava. It's not a replacement for professional medical care. To sum it up, Kava can be safe and helpful for people with tension or anxiety-related fast heartbeats, but you have to use it responsibly. Start low, go slow, avoid mixing it with alcohol or sedatives, and always check with your healthcare provider if you're on medications or have heart or liver problems. Now, let me share my personal experience with Kava. When I first decided to try it, I was dealing with mild anxiety and that tense feeling in my chest that made my heart race a bit. I wasn't sure how my body would react, so I chose to start with a small amount. I tried the traditional Kava tea, which is made by soaking the powdered root in water. The taste was earthy, a bit bitter, and it made my mouth feel numb, kind of like strong black tea, but with a little tingle. After sipping it slowly, within about 20 to 30 minutes, I started to feel my muscles relaxing. The tension in my shoulders eased up, and my racing thoughts slowed down. It wasn't like being sleepy or knocked out. Instead, I felt calm and clear-headed, which was exactly what I needed. The important thing was that I started small, a low dose, so I could see how my heart and body responded. I didn't mix it with anything else, like alcohol or caffeine, and I made sure to drink it on an empty stomach. For me, Kava became a helpful tool to manage tension without making my heart race worse. But I always remembered to listen to my body, and if I felt anything unusual like nausea, dizziness, or a faster heartbeat, I'd stop immediately. If you're considering trying Kava, I recommend starting this way: slow, careful, and paying close attention to how you feel. If you decide to try Kava, it's super important to do it safely, especially if you have tension or tachycardia. Here's what I learned and what experts recommend. First, talk to your doctor before starting. This is really key if you have any heart problems, liver issues, or if you're taking medications. Your doctor can help you figure out if Kava is safe for you and how to use it properly. Second, choose the right form. Kava comes in different options: traditional root powder, tea, capsules, tinctures, or extracts. If you want to try the traditional experience, the powdered root steeped in water is the way to go. But if you prefer convenience, capsules with standardized cavalactone amounts are a good choice. Third, start with a low dose. That means about 100 to 150 milligrams of cavalactones, which are the active calming ingredients. Starting low helps your body adjust and lets you see how you respond without overdoing it. Fourth, be patient. After taking Kava, it usually takes 20 to 30 minutes to start feeling the calming effects. Don't rush to take more. Fifth, avoid mixing Kava with alcohol, sedatives, or caffeine. Combining these can increase risks like liver problems or feeling too dizzy. Sixth, don't use Kava every day. Limit it to 2 or 3 times a week to avoid overloading your liver. And finally, listen to your body. If you feel any unusual symptoms like nausea, dizziness, or a faster heartbeat, stop taking Kava and check in with your healthcare provider. Doing these things can help you enjoy Kava's relaxing benefits safely, especially if tension and tachycardia are concerns for you.
Part 7. Final takeaways. Should you try it? So should you try Kava if you have tension or tachycardia? Here's what I want you to remember. Kava might be a helpful way to calm your nerves and reduce tension without the jitters you get from caffeine. If your fast heartbeat is caused by anxiety or stress, Kava could help relax your nervous system and ease that racing feeling. But if your tachycardia comes from a heart condition or other serious health issues, it's best to avoid Kava unless your doctor says it's okay. Kava isn't a cure or a replacement for medical treatment. For me, Kava became a tool, something I used occasionally to manage tension, not a daily habit. Starting slow and being careful made all the difference. At the end of the day, listen to your body, be safe, and always get medical advice if you're unsure. If you're feeling overwhelmed by tension or a racing heart, remember, you're not alone. Many people struggle with these feelings, and it's okay to look for natural ways to help calm down. If you decide to try Kava, start slow, pay attention to how you feel, and always check with your doctor first. Your health matters. Thanks for watching. If you want clear, simple answers to real health questions without the medical jargon, subscribe and hit the bell. I'll see you in the next video. Take care and be well.
Part 8. Final Thoughts. To wrap up, Kava can be a helpful natural tool for reducing stress and tension. But if you have a fast heartbeat, tachycardia, or high tension, you need to be careful. Always check with your doctor before trying Kava. Make sure your heart is healthy enough and that you're not on medications that could interact badly. If you do try it, start with a low dose, use traditional Kava tea, and listen closely to how your body responds. And remember, there are many other safe ways to relax that don't involve risk to your heart. Thanks for listening. Take care of your heart and mind, and if you have questions, talk to a healthcare professional. Stay safe and be well.
We talk in simple language about complex things. How coffee affects your heart, what tachycardia really is, why anxiety makes your heart race, and how not to get lost in all of it. If you love coffee but often feel anxious, experience a fast heartbeat, or just wonder if it's safe, this channel is for you. I'm a doctor, but I don't speak in medical jargon. I speak from experience. Here, you'll get science-based advice, clear explanations, real-life stories, and most importantly, clarity, not fear. Join us to understand how to take care of yourself wisely. Your health isn't a mystery. It can be understood.